understanding and managing backache. What is homeopathy? Like, we always just put this note so that everybody knows what homeopathy is, that we don't only aim to treating symptoms, but it is a holistic approach and we consider the individual as a whole. So now let's focus on backache. Understanding backache. What is backache? Backache or back pain is discomfort or pain felt in the back, typically in the lumbar or the lower or the thoracic, that is the mid back, or the cervical or the upper regions. It can range from mild to severe and may be acute, short-term or chronic, lasting over 3 months. Only then we term it as chronic. Common causes include muscle or ligament strain, overuse, which may occur due to overuse, heavy lifting, or poor posture. Disc issues, herniated or bulging disc, pressing on nerves. Spinal conditions such as sciatica, scoliosis, or spinal stenosis. Injuries like sprains, fractures, or any kind of trauma. Lifestyle factors like sedentary habits leading to obesity or improper ergonomics. Medical conditions like arthritis, osteoporosis, or infections can also potentially cause backache. Symptoms include stiffness, aching, sharp pain, or radiating pain, which will be going down to the legs in cases of sciatica where the nerves are affected. Treatment depends on the cause and severity, ranging from rest to physical therapy to some pain relievers or alternate medicine, or maybe surgery in severe cases. If it is persistent or severe, it needs proper diagnosis and tailored treatment. 80% of adults experience back pain at some point in their lives. This reference is from the National Institute of Neurological Disorders and Stroke. So raise your hand if you have ever had back pain. Any of you have had back pain? How many of you have had back pain? How many of you have had back pain? It's a very common disorder. It is found in nearly 80% of people. So let's see what backache is, how to recognize it, and practical steps to prevent and manage backache. So first we look at the causes. What causes backache? Lifestyle factors like poor posture, like slouching in your chair or the desk, sedentary behavior like prolonged sitting, improper lifting techniques, not engaging the core and just letting the weight go on your back, improper lifting techniques, physical factors like muscle or ligament strains, herniated or bulging discs, arthritis like osteoarthritis or ankylosing spondylitis. Osteoporosis, one of the major causes of backaches, usually in the elderly and in the menopausal group as well. Weak bones leading to fractures as well. Other factors are obesity, extra weight that strains the spine. Stress causes muscle tension. Mental stress, emotional stress also causes muscle tension. Medical conditions like kidney stones, infections, or rarely a cancer might also cause backache. How to recognize backache and know when it's serious? Common symptoms: dull or sharp pain in the back, stiffness or reduced mobility, pain that worsens with movement or even at rest. The red flags that require immediate medical attention are severe pain after a fall or injury, numbness, tingling in the legs, loss of bladder or bowel control, like the cauda equina syndrome, which is an emergency and you need to quickly go to the A&E in such cases. unexplained weight loss or fever, possibly infection. Unexplained weight loss is in cases of cancer, whereas fever could be probably an infection when the backache is associated with fever. When to see a doctor? If you have a persistent pain for more than 4 to 6 weeks, or like we previously mentioned about the red flags, or if the pain is disrupting your daily life, you are not able to carry on your routines, then it's important that you see a doctor. Lifestyle changes. Maintaining a healthy weight reduces spinal stress. You have to quit smoking because if you don't smoke, then it improves the blood flow to your spine. Because even anemia is known to cause backaches. If your spine isn't getting enough blood flow, then it can be a cause of backache. So even anemia is one of the causes of backache. Then manage stress, like doing deep breathing, mindfulness, these help with backache. Sleep hygiene, using a medium firm mattress, sleeping on a side with knees bent or back with pillow under the knees. If you're sleeping on the back, it is always better to have a pillow under the knees. Now about the posture and ergonomics. Use of ergonomic furniture, lumbar support chairs, they are important. Or if you are sitting on a workstation, you need a lower backrest, which is important. Monitoring the height of your device and the keyboard position. All these things are important because if your keyboard is quite high, you might land up having pain in the upper back. So it is important that your keyboard is at a proper level and your screen is at a proper level. These things are really important because at times just these simple adjustments, you can get rid of backache. Exercise and strength. Core strengthening exercises like planks and bridges, they help build your core. And when the weight is transmitted through the core, you tend to get less backaches if you have a strong core. Flexibility routines like the cat-cow yoga pose. Regular movement like walking, swimming, maybe 150 minutes a week is advisable. Management and treatment options. It's self-care. You have to take rest. If you are having a backache, don't overdo. For short term, avoid prolonged bed rest. It shouldn't be that you're lying down all day, because lying down all day will cause wasting of muscles. It will bring deconditioning in your body, and the pain will, on the contrary, increase. So you have to have short intervals of rest so that the pain gets better, but then you again have to move. Movement is the key. Ice and heat therapy. Ice for acute pain, heat for stiffness. If there's acute pain, you can apply ice. But if you think there's stiffness, then it is always better to do hot heat fomentation. Professional treatments like physical therapy or physiotherapy, tailored exercises, manual therapy, chiropractic or osteopathic manipulation helps. Acupuncture definitely helps with pain relief. Homeopathic medicines, we have excellent homeopathic medicines which help you relieve backache. And if required, prescription medicines or surgery in certain indicated cases. Homeopathy offers several remedies for backache, selected based on the specific symptoms, location, and nature of the pain. Below is a concise overview of commonly used homeopathic remedies for backache. Rustox. For stiffness and pain in the lower back that worsens with rest and improves with movement or warmth, often suits those with pain from overexertion or strain. It is often indicated in robust individuals who are very muscular, but due to overexertion, they tend to get backache. Then Rustox is the remedy. Arnica montana for backache due to injury, especially blunt injury, trauma, or overexertion. Even mental trauma, arnica works wonders if you get backache due to mental trauma, with soreness and bruising sensations. Bryonia. For sharp stitching pain worsened by slightest movement. Bryonia is kind of no touch remedy. You touch the patient, he is in pain. The patient moves, he is in pain. There's light in the room, the patient is in pain. There is noise in the room, the patient is in pain. So the slightest jar or movement will cause pain, such as the bryonia patient. And it is often indicated for lumbar region pain. The patient is better by rest and better by pressure. Kali Carb is one of the topmost remedy for backache. For lower back pain, especially with weakness, especially if accompanied by a sensation of the back giving out, as if that this is enough, now I can't take it. The back gives way and you have to take a rest. This is the case where Kali Carb is indicated. And the pains are usually worse at night or in cold weather. Nux vomica. This is another remedy which we commonly use for backache. There are hundreds of remedies we use, but these, what I am listing, is a few common remedies we use. Backache from prolonged sitting, desk work, ambitious individuals, workaholics, those who have tendency towards alcohol, overindulgence, they stress themselves out. Executive officers, pain is often spasmodic and better with warmth. The patient will feel better with warmth. In such cases, nux vomica, and especially there might be digestive disturbances associated as well with backache, then nux vomica is indicated. Hypericum perforatum. This is a remedy specifically for nerve pain, for nerve-related back pain, such as after spinal injuries or with shooting, tingling sensations. The pain will go all through the leg like sharp pains, lightning pains. Such are the pains of hypericum. Calcarea carb. Calcarea carb is one of the chronic remedies. It is for chronic backaches in fat, fair, flabby females. That is what the mnemonic goes like. In those with weak muscles, worse from cold, damp weather, and they are better from warmth. Homeopathy is individualized treatment, and the remedies depend on specific symptoms, the pain type, the aggravating factors, the ameliorating factors, the concomitants. So it is important that you consult a professional homeopath for a tailored prescription. For severe or persistent backache, it is important to get a medical evaluation done. All the investigations are mandatory to rule out if there is any other cause, any medical cause related to the backache, or any serious condition like disc issues or any infection. So backache should not be taken lightly. This is like I always say, this is always my tagline, that what we are what we eat. So diet plays a major role in every disease. And similarly, in backache, we have diet as a supportive role in managing back pain by reducing inflammation, by supporting tissue repair, and maintaining a healthy weight to reduce strain on the spine. So now we'll go through some dietary recommendations, general nutritional principles. So the key dietary principles for backache: having anti-inflammatory foods. Like we had done one webinar on anti-inflammatory foods. The way we eat food, sorry. So we will
I believe Dr. Geeta's internet has been unstable. She might probably log in back. Sorry, Dr. Geeta, seems we lost you. I'll just pin you back.
I was just continuing the presentation. I thought it's still on.
Yeah, we just found you gone from the meeting, so I assumed it's the internet probably.
No
But
problem.
thank you.
No problem.
Yes, you can start sharing again your host.
Yes, please. I will do that. I think we have done all this and we were on the diet. Are you able to hear me now, Dr. Neha?
Yes, we can hear you now. Yes,
Yeah.
you were talking about diet and anti-inflammatory, which we covered before, and that's where we lost.
All right. Okay. Perfect. So I'll start again over there. So anti-inflammatory foods. Chronic inflammation can worsen backache, especially conditions like arthritis or disc issues. So what do we need to eat? We need to eat omega-3, eat as in not eat omega-3 fatty acid, but foods rich in omega-3 fatty acids like fatty fish, salmon, mackerel, sardines, chia seeds, flax seeds, walnuts. Fruits and vegetables like berries, leafy greens, especially spinach and kale, broccoli, cherries, oranges, all these are rich in antioxidants. Spices like turmeric and ginger. Turmeric should specially be taken with black pepper for proper absorption. So these are the two main spices for backache: ginger powder, dried ginger powder, and turmeric with black pepper. And aim for a colorful plate to maximize antioxidant intake. So, regarding the bone and tissue health, we need to have strong bones, muscles, and connective tissue to support the spine. There is some problem with the system. I'm so sorry about that. Yeah. So, what do we need to eat? Foods rich in calcium like dairy, milk, yogurt, fortified plant milks, kale, almonds, sardines, vitamin D rich foods like egg yolks, fortified foods, and of course, we are having the beautiful weather, which is giving us plenty of vitamin D. So make the full use of that. Magnesium, which is important for bones and muscles both. So it's important to have some nuts, seeds, whole grains, and avocados, which are rich in magnesium. Also, mint leaves are rich in magnesium. Protein is the building block of muscles, bones. So it is the building block of the whole body, in fact. So it's important to have plenty of protein, lean meats, fish, egg, legumes, and tofu. So we were speaking about proteins. So what to eat? It's important to eat high fiber foods like whole grains, vegetables, legumes, and low sugar foods. It's better to avoid processed sweets, opt for natural sweeteners like fruit. Consume healthy fats like olive oil, avocado, nuts, but in moderation, of course, because fat is ultimately fat. Focus on portion control. Dr. Neha, I'm extremely sorry. There is some problem with the system, so there are some disturbances.
No, please don't apologize. As long as you're okay. I know you're puffing as well.
Yeah,
Want to take a pause? We can wait. Don't worry. Don't rush.
No, at all, no problem. So it is important to have portion control and balanced meals to maintain a healthy BMI. Because if your BMI is more and you're obese, again, the backache increases. So to avoid backache, it's important to have a healthy BMI and to maintain your weight. Hydration. This is so interesting. There are many people who have backaches and it is only due to low hydration. If I would advise them to drink plenty of water, they start feeling better. So proper hydration keeps the spinal discs, which are mostly water, healthy and flexible. So drink 8 to 10 cups of water daily. Make sure. I always tell my patients when usually in the history, we ask for thirst. If the patient says that I'm thirstless, then I tell them, put an alarm every hour. Make sure you pick up a glass of water and drink some water. So it's important to keep yourself hydrated, and especially in this weather. And you should include hydrating foods like cucumber, watermelon, and soups. And limit dehydrating drinks like alcohol and excessive caffeine. Sorry. So foods to avoid. Certain foods can increase inflammation or contribute to weight gain. Avoid or limit processed foods like fast foods, sugary snacks, refined carbs. This all we had learned in the webinar on anti-inflammatory diet. Trans fats are inflammatory. Excessive red meat, high sodium foods. These all promote inflammation. So it's important to read the labels so that you can avoid sugars and trans fats. Again, this is one more important topic. Yoga. Yoga is very, very effective in backaches, but you have to know what to do and when to do and how much to do. That is very important. It can worsen your backache also, it can help as well. So it's important to take help of a yoga instructor. Yoga can be an effective way to alleviate back pain by improving flexibility, strengthening the core, muscles, and promoting better posture. Below are some yoga poses and tips tailored for backache relief based on general knowledge and best practices. Always consult a healthcare professional before starting if you have chronic or severe back pain, and practice under the guidance of a certified yoga instructor if possible. So yoga poses for backache or back pain relief rather. You should be holding these poses for 5 to 10 breaths and then move to the next. So first is the cat-cow pose. Start on all fours with hands under shoulders and knees under the hips. Inhale, arch your back like a cow, lifting your chest and the tailbone up. Sorry. And then exhale, round your spine like a cat, tucking your chin and pelvis. Flow smoothly between these for 6 to 8 breaths. The benefits. It mobilizes the spine, relieves tension, and improves flexibility. These poses are gentle and focus on stretching and strengthening the back, the hips, and the core. You have to hold each pose for 5 to 10 breaths and then move slowly to avoid strain. So we learned about the cat-cow pose. And the next pose is the supine twist. Lie on the back, hug one knee to your chest, and then guide it across your body towards the floor, keeping shoulders grounded. Extend the opposite arm and gaze towards it. Switch sides. It releases tension in the lower back and improves spinal mobility. Try to use a pillow under the knees for support if the twist feels intense. Never overdo in backache. The moment you start feeling pain, stop there. This is an important tip. Bridge pose, that is the Setu Bandhasana. Lie on your back. This is quite easy. I think many of you must be doing it as well. Lie on your back with knees bent and feet hip width apart, and then close your hips, press into your feet, and lift your hips slowly towards the ceiling, keeping shoulders and head grounded. It strengthens the lower back, the gluteus, and the core, supporting spinal alignment. Avoid overlifting the hips to prevent strain. Keep the movements controlled. This is very important in yoga. You have to avoid strain, avoid overstretching, and keep movements very controlled. So there are these few yoga poses which can help, diet and nutrition which can help, homeopathy can help, and physical therapy, acupuncture, of course. So these modalities are complementary. And if you are suffering from severe pain, you can also go for pain relievers. And in cases where there is emergency, it is important to seek help. If it is a surgical case, you need to seek surgical help. So, and if it is a kind of infection, or it's a severe injury where there is a possibility that your spine has herniated, so it's important that you seek immediate attention in such cases. So you shouldn't be taking backache lightly. If you need any help, or Dr. Neha, are you able to hear me?
Yes,
Hello?
yes, I'm here, Dr. Geeta. I'll